Hi, I'm Dr. Ellie Cannon and I'm a GP and a health writer, and today I'm going to talk to you about how to treat a stye. A stye is a type of eye infection that actually occurs not on the eye itself but the eyelid. What happens is some bacteria get into one of the eyelash follicles and you basically get a little spot on the eye, just like you can do on any other part of the skin. And these can feel itchy and tender and sometimes painful. Now there are some things you can do at home to get rid of a stye. Firstly, most styes actually don't need any treatment. Now that's really important to know, that actually a stye will go away itself after 3 to 4 days. So if you've just noticed the spot and it's not really bothering you and it's not particularly uncomfortable, then it's fine to leave it to see if it goes itself within 3 to 4 days. The most well-recognised treatment for a stye is actually to use what we call a warm compress. What you do is you take a clean flannel and you run it under hot water until the flannel itself becomes hot, and you place that over the eye. As long as it's not too hot, it must feel comfortable. You place that over the eye for between 5 or 10 minutes, and you do that 3 to 4 times a day. The idea of that treatment is it allows the infection to drain away, and that actually is the most effective way to get rid of a stye. What you can also do to help that treatment, if you notice that the stye is really on the outside of the eye, if there is an eyelash there in the middle of the stye, you can carefully pluck that eyelash, and that allows the infection to drain away. Now obviously that's something you have to be very careful with, and only do it if you can really see the stye is at the base of an eyelash. I would never recommend squeezing a stye. A really important message I want to tell you about styes is you do not need antibiotic treatment for a stye. So you should not be given antibiotic eye drops or antibiotic eye cream either by the GP or the pharmacist for a normal stye, because that is an unnecessary treatment, and we know that actually the warm compress that I've described is the most effective way to get rid of a stye. Other things you shouldn't do with a stye: you shouldn't wear your contact lenses, you shouldn't wear makeup, and you should avoid touching the eye apart from to do the hot compresses. So that's how to treat a stye. Remember, warm compresses and no antibiotics.